Can we start? Oh.
Yes, namaste.
Namaskar ji, Mantri ji. How are you?
Hi.
Thank you, ji. Thank you. So we'll just get started. In fact, it's absolutely a proud privilege for me today to really have the Honorable Minister, Union Minister of Health and Family Welfare with us today. We have the Health Secretary as well, Mr. Bhushan. We have Hari Menon who's joining in, and we have Subbu joining in from Harvard. The agenda for the day is multifold. In fact, Richard and I did a piece on estimating the economic impact of vaccination and related measures. If you really look at what has happened across the world, it was something very, very significant in terms of like the negative impacts that were happening across the world. It did bring the world to a standstill, but there was something important that happened in India. And I have been studying many, many things across the country, especially the kind of initiatives that the Ministry of Health had taken from vaccination to vaccine development. And they had a tremendous effort that was actually going on. But for this, we actually did a paper together, which was reviewed by my dear friends here, Michael Lindwright and Mark Esposito. But before we get to the presentation, Honorable Minister, if you allow me, we would like to present the Porter Prize first to you and the ministry. I just wanted to read a couple of things. If you really look at it, Porter Prize is named after Professor Michael Porter, who is at the Harvard Business School. This is something that we have been doing since 2012, but we did pause for a bit during the times of the pandemic, but we studied a lot over a period of time. But there's something very important. There are 5 things that actually happened, and that was that there is India's management of COVID, which was absolutely exceptional, involvement of stakeholders in the whole strategy that the government of India was following, especially involvement of people like ASHA workers to industry, to creating the PPE kits. It was an exceptional exercise in really moving things forward. The whole idea of vaccine development, vaccine manufacturing, if you really look at the kind of scale that India actually achieved over a period of time, was absolutely tremendous. And of course, if you really look at the vaccine delivery, India has delivered more than 2.5 billion doses as of today. And that has just been something amazing. And in light of this, we wanted to present the Porter Prize to the Ministry of Health and Family Welfare this year. And I would like to read the citation, and that would be, for redefining healthcare, providing an overall framework for diagnostics, participating in building a resilient healthcare system, focusing on providing value to patients, not just lowering costs, free flow of information, that is information on results and prices needed for value-based competition and innovation in healthcare, such as enhancing the patient experience. So if you really look at it, it's a proud honor for me to really present the Porter Prize for this year to the Ministry of Health and Family Welfare. Thank you for really accepting this award from our side, Honorable Minister Bhushanji. But I have my very dear friend and colleague from Harvard, Christian Kettles, who's part of the Institute for Strategy and Competitiveness. Christian, if you would like to just say a couple of words on this and the honoring of the Ministry of Health this year.
Yeah, let me join into the congratulations. What could be a more appropriate way to give the Porter Prize to the Ministry of Health and Family Welfare after the pandemic. Professor Porter is at sabbatical at the moment, but I'm sure he would wholeheartedly support this choice and be very happy that his name and the prize is used in this way. I would like actually to make 2 comments of why I think this is so important that we look at the Ministry of Health as the recipient of the Porter Prize. I think one is, and we talked about this throughout today, that for India to be competitive and successful, we need to have a competitive government. We need to have a government that's able to set and execute on strategies. So I think it's not a mistake, but quite the opposite, to really honor in government institutions about the strategy it has followed in responding to the pandemic. The second point that I would want to make is that we've also talked throughout today about the need to see the social agenda and the economic development agenda as something that's actually combined and not different silos. So again, I think giving the Porter Prize to your ministry in recognizing how important the work that you've done is not only for the health outcomes, but also for the economic development outcomes for your country. think it's a very appropriate choice of recipients. So again, congratulations, and I hope it is as much as a prize for what you have achieved as it is an aspiration for continuing that great work that you've done into the future.
Thank you. Here, here. So with your permission, Honorable Minister, we would just like to make a short presentation on the paper that Richard had actually done and I had done together. But Richard is going to make the presentation on what we really find and see as to what is the economic impact of COVID vaccination and other measures. Over to you, Richard, please.
So I think I'll just stay here. But if I could have the slides, please, that would be great. So Amit and I thought that it would be really important as quickly as possible to try to measure the economic impact of India's response to the COVID pandemic. This is certainly not going to be the last word on measuring economic impact, but hopefully it will be a good kind of stake in the ground, a first place to look with the information and the data that we had available to us. And this will allow for further refinements, higher resolution views in the future, as well as really looking at some of the modeling that we did and see how it works out over the long term, to see if the economic impact 10 years from now really does look like what we are predicting in this paper. Slides?
Can we have the slides up, please?
Okay. So what we looked at, first of all, yeah, we can go to the next paper. There's one gross inaccuracy here. Oh, I see, that only has my name on it. That's the inaccuracy, right? Amit is definitely the lead author on this paper. My role was mostly to question assumptions and give him a hard time about the modeling. So what we wanted to look at was, you know, the response to COVID, which on a worldwide basis, you know, caused a contraction in the world economy of 3.5%. India's response was really in 3 different areas. Let's go to the next slide. First was actually containment. That was the first thing that the government could do. And really, the vaccination program required the development of the vaccine. So it came along next, and kind of simultaneously with the vaccination program, actually from the time of containment, was the relief package for economic relief to the people. So if we can go to the next page, in this paper, we put the vaccination, actually it has gone through a couple of iterations, but in this presentation right now, we'll talk about the vaccination first. Because in some ways, this is the area that has been least analyzed for economic impact. The economic relief has been analyzed, the containment strategy has been analyzed in the past, but this is kind of new. We are fortunate that in India there was not a big political fight about whether vaccination should happen or not. And so we were able to use government information. Essentially, the basic facts of the vaccination campaign. The kind of containment, isolation, started really in March 2020 with a number of government shutdowns. It took almost 9 or 10 months to deliver the first vaccine, which is in itself quite amazing. But even more amazing than that was that within 18 months, they had administered over 2 billion doses of the vaccine. This was not easy. First of all, people were afraid to get together. So it was hard to get people to come to centers to be vaccinated. India is a huge, complex, heterogeneous country. So there were language differences, there were cultural differences. It was very critical to get people on the front lines to be supportive of the vaccination program. And many of them felt at risk and felt like they were not sufficiently supported. So this was some of the challenges that existed. An interesting challenge that came out to me is that vaccination in India had largely been something done for children as they approached primary school. And so the idea of vaccinating adults in the population was new to a lot of people. And getting people used to that whole idea was not trivial. So what we did is we looked at this message in terms of the income that would be generated by the lives saved through the vaccination campaign. If we can go to the next page. Next slide, please. Oh, this is our working method. Okay, that is the next slide. No, go back to that, please, because this is kind of important. Essentially, we were using government data on the number of lives that are estimated to have been saved by the vaccination campaign. And there are three main ways you could calculate it. We did a baseline kind of calculation. Really, the simplest way is if you treat everyone at minimum wage and you look at the minimum wage per day, the number of days in the working year, using a population distribution of the people who were saved, how many years in total were, working years in total were saved to allow for income generation. And so that minimum wage is kind of the simplest way, but of course people don't work at minimum wage. So the second way was to use GDP per cap. So the per capita GDP is across the population and would include children, would include very elderly people as well. So that's the second approach, is just to use average per capita GDP and see what was the total produced by all of the people who were saved by the vaccination campaign. The third way is to look more specifically at the employed persons. This does include the informal economy as well as the formalized economy, but it's basically the working age population, and use that as the basis for calculation. All of this was the top side of the fraction, and we subtracted the costs of the vaccination campaign, which are estimated to have been $2.7 billion. So let's go to the next slide now. So over on the left-hand side, you see the minimum wage. This is just really the baseline. If you look at the direct benefits, you see that at minimum wage, the direct benefits over the lifetimes of the people who were vaccinated does not equal the costs. It turns out to be a negative number. The government would look like it loses $1.2 billion on the vaccination campaign. If, however, now moving over to the middle column, the GDP per cap, at just the direct benefits of what these people earned, you come up with a positive number, about $2.4 billion of GDP per cap. And then if you look at the GDP per person employed, it was a little, you know, at constant prices, it was about the same, and it was a bit less at current prices because prices are always going up. GDP is always going up too. But the kind of top half of this, you see that the campaign was able to generate somewhere in the neighborhood of, you know, $4 billion net after the costs were looked at. What's important, though, is that it's not just the direct income of the people whose lives were saved. We used a Keynesian multiplier, and we based our calculation of the multiplier on the Bank of India study of 30 years of Indian economic activity, where 1% of income increase would be seen to be associated with about 2.5% increase in other incomes. So the total impact, we used a flat multiplier of 2.5x. So if you look at the total impact in terms of the economy, even at the minimum wage, it's a little bit on the positive side, and it becomes much more significant. We're talking 10 or 11, $15 billion by the time you get down to the total impact of GDP per employed person. But that does ignore the distribution of the population. A lot of the people who are saved were elderly, or they were children who have a longer earning period, but they're not earning yet. So if we go to the next page, what we did, next slide, please. What we did was we did a more fine-grained view of just who was saved by the vaccination campaign. And if you look at that, you see that the numbers are not as good with the minimum wage, minus 1.7 billion. And even if you look at the total impact, if you're really doing this more careful approach to the whole population, it was minus 0.2 billion when calculated by the minimum wage. But if you look at the per person employed GDP impact of the campaign, the direct impact at constant prices was a little bit over $700 million US. At current prices, it was about $2.05 billion. And the total impact, not just people's direct incomes, but how much they were able to stimulate the economy going forward, was almost $6 billion at constant prices and almost $9.29 billion at current prices. So this is a significant impact for the vaccination campaign. We realize that there are assumptions here, but one of the things that I'm excited about is that we have this stake in the ground now. And if we can do a study 10 years from now about if we can track these people and really see how this looks, we will have something that I think will really be very useful. Moving on to the next slide, please. So we looked at, this was essentially the learnings from this. We can jump over this slide, I think. Yeah, so the containment strategy started with a series of government shutdowns. Notice that this directly is a negative impact on the GDP of the country. However, it had three big impacts. Keeping people away from each other did save lives. It also reduced the total cost to the healthcare system. Especially, it prevented the healthcare system being overwhelmed, which could have had, a disastrous impact that was avoided. This gave the health infrastructure time in which they could be ready to deal with the challenges of treating COVID, especially to give them time until the vaccine could be developed. We did not really do much besides a literature review of this, because the Economic Survey of India for 2020-2021 dealt with this. So did the Minister of Health's Family Welfare Statistical Analysis. Moving on, we took a look at the government relief packages, which was huge. The total amount of government relief in India was over $280 billion, as reported by the IMF. This involved government spending, which is a direct fiscal stimulus, and it also involved indirect, below-the-line support for business and so forth. We looked at four areas. We looked, next slide. We looked at micro, small, medium-sized enterprises. Let's go on one more slide. And we looked at, different shutdown rates. The two numbers that we have on this slide reflect what percentage of businesses actually had to completely close down. But you're seeing some impact there. The second area that we looked at was the social sector. Next slide, please? This is the social sector, right? No, employment. Employment's next.
So,
We looked at...
you just have 1 minute to go, please.
1 minute, okay. We looked at 2 different packages here and came up with different versions of that. Next slide was the social slide. And we looked at 2 different relief packages, one of which was more comprehensive. The upper number is more comprehensive across the population, and the lower number is specifically making sure that people with less income had food. And the fourth one was the agricultural sector. Next slide, please. Where really we looked at the number of direct loans and so forth that were allocated. We also looked at what was actually distributed. So all of these are kind of codifying the economic actions by the government. If we can go to the last slide. So it's very important to measure impact like this, not just to have a sense that a lot of people's lives were saved. It's a little bit kind of actuarial in order to put a value to someone's life. But we think that this is important going forward, and we're very happy that we were able to have the cooperation of the government to receive information and data for them. The last point, though, is that any kind of study like this depends on the quality of the data. And so that's kind of a disclaimer that we have to make. But thank you, and I look forward to hearing the discussion about economic impact and your insights into
Sure.
this. Thanks, everybody.
Thank you, Richard. So just one very quick thing. I think what we have used is very deflated numbers in terms of calculating the impact, because I think the impact is going to be far larger if we start digging deeper in terms of the real incomes and so on and so forth. But what I see is what we have seen is just yearly impact. If you aggregate it to the next 10 years or 20 years, the impact is just going to be significant. In terms of the death rate, we use the Lancet data, and we have again used the maximized Lancet death rates that they've actually used to really make sure that we are not underestimating or overestimating any of the things. So that is what we have done. But now I have to request the Honorable Minister to really make his comments. I know he has a flight to take in the next 15, 20 minutes, but Honorable Minister, over to you, and look forward to your views, please. We are not able to hear you, sir.
Thank you. Namaste.
Namaskar, sir.
You are hearing?
Yes, absolutely, sir.
Yes, yes. Good evening, delegates and friends. I am elated to be a part of this discussion with all of you. During the release of the paper, Healing the Economy, estimating the economic impact of India's vaccination and related measures, I would like to congratulate Mr. Richard Dasher and his team for their dedicated effort on this comprehensive report. This report is pertinent in culminating the massive efforts taken by India during COVID, and how those efforts have led to an economic impact across the domains. Friends, the catastrophic nature of the COVID has been evident across the world in past 3 years, and India being a country of more than 1.4 billion people posed multiple challenges, which require a close-knit response from everyone, including the community. India adopted a all-of government and all-of society approach in a proactive, preemptive, and graded manner, thus adopting a holistic response strategy for effective management of COVID-19. Honorable Prime Minister Narendra Modi ji initiated a preemptive response much before COVID-19 was declared a public health emergency of international concern on 13 January by the WHO. We created an administrative structure with setting up 11 empowered groups to focus dedicatedly on various aspects of pandemic management, like drugs, vaccination, logistics, etc., as early as 29th March 2020. And overall guidance was provided through constitution of groups of ministers with representation from relevant ministers to take critical decisions to manage COVID situations in the country. Honorable Prime Minister Narendra Modi ji, with his early call for voluntary lockdown, paved the way to include community in this response, which is our mainstay in fighting this invisible virus. Union Ministry divided the five-fold strategy of test, track, treat, vaccination, and others to COVID-appropriate behavior to initiate a rapid and robust institutional response. Within a short span, we augmented health infrastructure in terms of COVID-related beds, drugs, logistics like N95, PPE kits, and medical oxygen, while continuously upskilling the human resources through Center of Excellence and online interventions. For early detection of virus, we ramped up testing infrastructure at an unprecedented scale with more than 917.8 million total tests conducted so far. We also set up a network of 52 labs for genomic surveillance, which has helped us to monitor the emerging variants of the virus. Further, we leveraged digital solutions like e-Sanjeevani telemedicine service, Arogya Setu, COVID-19 India portal, RT-PCR app, etc. helped us to stay ahead in our response with data-driven insights and analysis. While the containment efforts yielded results in limiting the spread of infection, India equally focused on vaccination development since the onset of pandemic. We prioritized scientific evidence-based vaccine development, vaccine production, just-in-time logistics, including ensuring vaccine availability across the country. With a mission mode approach for vaccination, India launched world's biggest vaccination drive on 16 January 2021, and till now, we have administered more than 2.2 billion doses, with 97% is first dose coverage and 90% is second dose coverage of eligible beneficiaries. The vaccination program ensured equitable access by offering vaccines free of cost to all citizens. Further, national-wide campaign like Har Ghar Dastak, house-to-house vaccine, and mobile vaccination teams were established to ensure access for elderly and specially abled citizens and vulnerable groups. The vaccination drive was supported by the relentless efforts of our vaccinators, whole traverse mountains, deserts, and difficult geographical terrain to reach individuals in far-flung areas. We also utilized COVID vaccine management platform as its backbone, which monitored the dose administered across the country and provide QR code-based vaccination certificates. Partially, India focused on allaying fears, managing misinformation, and infodemic in the community through targeted information, education, and communication. Adopting a 360-degree response, numerous and timely financial packages were introduced, which were crucial in mitigating the economic fallout within the aim of minimizing the impact on social sector. Multiple schemes were utilized, such as Guaranteed Emergency Credit Line Scheme for MSME, Pradhan Mantri Garib Kalyan Anna Yojana for social sector, PM Garib Kalyan Rozgar Abhiyan, and Atmanirbhar Bharat Rozgar Yojana for employment generation, and various other schemes with a collective outlay of $42.3 billion for the agriculture sector. We also introduced relief package worth $4.3 billion to enable healthcare infrastructure augmentation, and states were financially empowered through allowing utilization of more than 50% of funds from the State Disaster Relief Fund. I'm happy to note that this rigorous study by Institute of Competitiveness and Stanford has helped in obtaining a more comprehensive understanding of the strategies deployed by the government in combating the pandemic. As mentioned in the report, India was able to save more than 3.4 million lives by undertaking the national-wide vaccination campaign at an unprecedented scale. While the prime focus of the campaign was always on saving lives, it also yielded a positive economic impact by preventing the loss of $18.3 billion. This resulted in net benefit of $15.42 billion for the nation. After taking into the consideration the cost of the vaccination campaign, with the help of schemes launched to support the MSME sector, 10.28 million MSMEs were provided assistance, resulting in an economic impact of $100.26 billion, which comes out to be about 4.19% of the GDP. Under the Pradhan Mantri Garib Kalyan Anna Yojana, the government focused on ensuring that no one slept hungry, and free food grains were distributed to 800 million people, which result in an economic impact of approximately $26.6 $0.24 billion US. The launch of PM Garib Kalyan Rozgar Abhiyan helped in providing immediate empowerment and livelihood opportunities to migrant workers. Through the scheme, 4 million beneficiaries will provide employment, which result in an overall economic impact of $4.81 billion US. While India has successfully managed the COVID impact in terms of saving lives, this report highlighted the economic value of the measure to provide a holistic view of the response. These post-COVID studies may continue and should be institutionalized to compile the efforts and their impact on design a much strengthened response for any future health emergency. I appreciate the efforts of the entire team of researchers and subject matter experts behind this report and urge everyone to go through it in order to understand the magnitude of economic impact brought about by our key strategies against the COVID-19 crisis. Thank you very much.
Thank you, Mantriji. Thank you, Dr. Mansukh Mandviya. Thanks a lot for joining us. But just one very quick thing. The paper is now available at asia.stanford.edu. So if anyone wants to download the paper, please go to the website, and it's available at the US ATMC website already. Would request people to actually go through it and things. And thanks a lot, Mantriji, for making these comments. It's a privilege to have you with us. And I think we look forward to your suggestion in terms of institutionalizing this work, trying to really replicate over a period of time and trying to see as to how things change. But with your permission, I would like to go further into the program. First, I would like to quickly request Michael Enright, if you could just make a few comments. You did review the paper, you made some suggestions which we have tried to implement, but over to you, Michael, please.
Thank you. Again, I recommend the paper to people. It's a very interesting read. A few comments, generally a couple of technical things. Number one, as Richard pointed out, this is going to be a moving target. So I think right up front, it would be important to give a date, because you had to close the gate, right? So just do that, because again, that will make life a little easier. Another thing is, you mentioned, difficulty in valuing a life, but that's actually not what you're doing. What you're doing is you're indicating the cost to the economy of someone not being there. If I'm not here next year, there's a cost to the economy. That's completely different than value to life. So I think you don't have to wade into that. With respect to the vaccination, again, setting off the costs and the benefits, I think is quite interesting. But there's a bit of a piece of the puzzle that's not quite there. The authors take a look at the potential impact of the economy of people who may have died without the vaccine. But that doesn't include the number of days that would have been lost by people who caught the disease, people who would have caught the disease without the vaccine, and the decreased transmission rate. Now, if you go over a life cycle approach, which is the right way to think about it, that is small, because it's not 20, 25 years, it's maybe 3 days. But if you're looking at short-term annual, my rough calculation is that the impact may be about the same, almost equal. If you assume 1% of people die, 3 days saved, you basically come out with roughly your 312 days. We can talk about current and constant prices. If you're doing short-term annual, the current and constant price should be the same. It's just you're using a different baseline. With the relief programs, again, I think it's better dealt in the paper. It's not possible to relate it all here. Is that we really have to be talking about firms that didn't go under, again, over a long period of time. Because otherwise, it just looks like, well, if government injects money into the economy, that you get a benefit, and, well, why don't we do a whole lot more of that, right? So it's really got to be set off with a postulate as to which companies wouldn't have been around, so therefore wouldn't have had subsequent economic impact over a long period of time. For those of you not familiar with the notion of the Keynesian multiplier, it's similar to some of the ripple effects I spoke to before, only it gets at them a different way. The idea is if incomes are supplemented, then people spend that income, and then the people who benefit from that spend the income. And again, it's a well-established concept in economics. I think the one that's a real challenge, actually, to do in detail would be containment. Because there the question is, the real difficult thing would be, if we didn't contain, or if we didn't contain at the same level, what economic benefit would that have generated, set off against a very, very uncertain estimate as to what might have been lost. But again, I think the authors are aware of these issues. It is a stake in the ground. It is something I'm sure you'll be following up on. And again, I do recommend it. It's a very interesting read.
Thank you, Michael. Thanks a lot. And I think as he's suggesting, the impact, if we really look at the numbers a little deeply in terms of how many lives were saved, et cetera, it could actually have a larger impact as we look at it. But that's where it is. But having said that, can I request Subbu, who's joining us from Harvard? Subbu, could you just give your comments, quick, short, 3 to 4 minutes, please? Subbu, we are not able to hear you.
I'm sorry, Amit. Thank you so much for this opportunity, and it is a great pleasure and an honor to be here. So let me just offer a few thoughts. I think Michael already gave some. First of all, I just want to congratulate you for taking on this rather big task. So on the vaccine per se, my one sort of observation is that India had a lot, in addition to the political will and the presence of an administrative governance structure, which was centralized but also decentralized right to the ground level. All of that came to play in terms of the vaccination strategy, which I believe the one thing I really liked about this paper, beyond the quantification, was that it is so underappreciated how India did this. Just the logistical way in which they went about doing it. Having said that, I'm not so sure, because India is a very young country. So I think to place the control, was it entirely through vaccine and the causality that's being assumed here? I would probably be a little bit more self-reflective, because India targeted their recipients initially very well, and eventually, of course, they kind of saturated. But I think India is a young country, so there were risks. Some of the risk profile was in favor of India, and we could see that even before the vaccine came. That the lives lost were far, far less below that. And in fact, I had written a kind of a provocative comment. Actually, the success of mass vaccination of India was pretty much happened when Delta wave came, because people came out to be vaccinated. So in some sense, the success of that campaign resulted in and then India very quickly calibrated itself to the home-to-home. And so the nimbleness of the vaccination campaign was amazing. My only sort of thing would be perhaps be a little bit more self-reflective on entirely was that due to just that or something else, because by then you had a lot of relief package going on. Companies were working off and on, even though there was not a full lockdown. So that's one sort of a big comment. My second big thing is is the next question. I think I always say this, there is no historical precedence anywhere in the world within a market democratic setup of providing for 1.4 billion people. There is just, you can compare, okay, in the early 1900s, US did this or Europe did that. We are talking about few millions here and there. This is the first time that there is a sort of effort that, and through COVID, that was demonstrated. So this notion of providing for about 1.4 billion people. Now, the question for me is, right from COVID to right to the shot in the arm, that success of India, can we do that even for the primary vaccines for children, right? So because this infrastructure and whatever was kind of came to being, can we sustain that in a way that there is no historical precedent. We can't look at any other country for this model to provide for 1.4 billion. India will have to create that model, and I feel there is an opportunity with the COVID success that India had. And my last sort of point would be mainly to sort of emphasize again this notion of the importance of the relief programs. We call it a relief programs, but also I have seen, like I work in the area of undernutrition. I mean, we have looked at some data, a couple of them under review. We really, I think those programs made a huge dent. We see no systematic pattern that people were predicting that India's stunting is going to go up, underweight is going to go up, all of this. We don't see that in the data to the extent we can parse out with the NFHS data before and after COVID type situation. So, but again, my thing is, I see some of that in the latest budget. I have not looked at it, to be honest, in great detail. But I think the challenge going forward would be, how do we institutionalize some of those relief programs in a financially sustainable manner? So I'll stop there, Amit. Thank you so much. And thank you to the Honorable Minister as well. It was very great to hear those remarks. And I too echo Amit's comment on how do we institutionalize this kind of work going forward that can benefit the current momentum that the government has shown with its political will to provide for people. Thank you.
Thanks a lot, Subbu, for joining us that late in the hour. Can I request Hari? Hari, if you could just make your comments, 2 to 3 minutes, please.
Yeah. Thanks a lot, Amit. Good morning, Honorable Minister. Good evening, everyone joining from the US. Good morning, Secretary, sir. So I just want to start by commending Richard and Amit for taking on this task. It's obviously a very complicated effort to try and quantify the impact of India's vaccination program. While the numbers of what India managed to achieve, which the report lays out, is mind-boggling in its own right. I think there's always been, and I'd say particularly in the last few years, an interesting argument about what is the economic case for investing more in health. And to me, actually, this report takes a big step forward, with all the caveats about the methodologies employed, etc., in that direction. I think, what India demonstrated during the COVID response and what we need to build on going forward is the importance of governments investing in social welfare, health, education, for the economic knock-on effects that this has. And it's particularly critical for emerging economies because, the human capital that we have only gets fully realized if it's given this potential to develop. And to me, while the impact of the COVID vaccination itself is great to see, this would be a great way for us, especially in India, to start thinking of, stronger, tighter documentation of the impacts of, putting more money into health, education, and the like. As the Honorable Minister mentioned in his remarks, the upgradation of health infrastructure that also took place during COVID, it'll be very important as, looking ahead to the next 5-10 years to see how that pays off as well in improving outcomes and contributing to economic well-being. So I do want to join Richard, the Honorable Minister, and Subbu in saying this should be an effort we keep going forward. I think it should be a longitudinal kind of exercise where we are able to keep tracking how, the improvements in infrastructure that were put in place, the expansion of testing facilities and capacity that was done, the very robust digital infrastructure that was put in place, how that can actually help improve delivery of essential health just going forward, like Subbu said. And I think the government is already doing this. The CoWIN app is now being adapted for India's universal immunization program. So that work is already underway. And I think that evolution is important to keep tracking. So I think that forward-looking element would be great to do. I think a second piece, which the report again does a great job. India's response was very comprehensive, and as someone who lived through India's COVID experience, partnering with the government, but outside of the government, I can personally go through that mental map of how we went from abject terror and hopelessness pretty much at the beginning, when there were all these very dire prognostications of what's going to happen in India, to then living through the phase when government came together, society came together, a lot of foundations came together to mount what the Honorable Prime Minister kept calling an all of society approach, an all of society response. And that, the way that played out is actually quite fantastic. And I think the report does start to mention some important elements of that, but I think there are important pieces that could do with greater mention to make this a comprehensive response. For example, the regulatory streamlining that India put in place to allow at-risk manufacturing and stockpiling, that's very critical. It's not something that India had done in the past. Similarly, I would say, the expansion of the vaccine channels that were put in place by bringing on board not just health workers, but really all sorts of frontline workers. So there are some of these elements that I think would be further detailed. So this becomes a comprehensive, go-to place for what India did during the response. The third element that I think would be worth looking at, again, going forward is what are the lessons for the world from this? Because, Subbu alluded to this, what India pulled off, in terms of the scale is quite, unparalleled. But India is a very diverse and heterogeneous country. So, by doing deeper dives into different parts of the country, states, districts, sub-districts, it would be possible to come up with maybe more detailed case studies of, contexts and situations that are relevant to other parts of the world. So ways that we can continue to learn from this. So again, I think this is a great first step. It's an important contribution to the literature on, the COVID response. And I think we need to keep building on this. So thanks again to Richard, Amit, and the whole team. And thanks also to the Government of India for supporting this effort by making available the data and details of the responses to enable this document. Thank you so much.
Thank you, Hari. Thanks a lot. And I must mention that the BMGF has supported the India Dialogue. So thanks a lot for supporting this initiative as well, Hari. Thanks a lot. And without further ado, I'll have to ask Mark to make his comments. But Mark, you have exactly 2 minutes, 120 seconds, or else I'm going to throw you off the stage. But over to you.
Well, actually, since it looks like it's the capstone comments before we finish the session.
The Secretary speaking after you.
The Secretary speaking, so from this perspective, from the stage, probably, right? So first thing is the example of the response of COVID in India demonstrated that there is a rise of what Stephanie Kelton calls a new modern monetary policy, in which a government is capable of creating the financial ability to support the response. He has generated the legal authority through the policy to make sure this was possible. But more importantly, he has created the productive capacity for the rise of new cluster, because right now, thanks to that, bioscience and biopharma in India are now prospering. So it's a perfect example that when you hear in the United States that we don't have enough resources for Social Security or Medicare, remind yourself that this is actually looking at the very narrow spectrum of the problem. The second reflection is that India has demonstrated that functional geography is more important than political geography, because fundamentally, thanks to this effort, the region, and I spent some time advising the Prime Minister in the UAE these days, has benefited greatly from the recovery, from the impact on trade that preserved the MENA and mainly the Gulf, to the fact that the food supply was guaranteed thanks to that, to the fact that the labor force, which is constituted in some country almost 30%, was actually constituted as viable and running. And also by preserving the labor force, we were preserving the remittances that go to some region of India that are part of the inflow FDI. So it's important to remember that what you have seen in this report doesn't only benefit India per se, but equally benefits the region. The last reflection on this is, and similar to what we heard before, it's really worth investing into what I call disruptive resiliences. The ability for us to think about future equity in addressing with collective action some of the challenges that we're currently facing. Back to the conversation on scale, if a country like India can manage with 1.4 billion people a challenge of this nature, we can actually really address challenges we're currently facing. So we should use this as a case study to understanding that challenges are only as big as our ability to aspire to address them. And I think the Indian case has fundamentally taught us this lesson. The very final comment I have on this, and I know I'm past the 2 minutes before he offload me from the stage, is that multilateralism or plurilateralism is now actually happening. We've been living in a decade of thinking about US and China as mainly the duopoly, and now India is rising as an alternative player. I think we start noticing more and more players around the world. They're fundamentally rethinking the geopolitics. And so this is probably the very beginning of decades of reshuffling of the political and global order. And I think India is a protagonist in this sense. So I'm very appreciative of the work that you have done with this paper, Amit and Richard, because you have fundamentally proven that this is much more than just economics. It's rethinking policy for a larger purpose. And so that's why it's a good contribution that I have been honored to review.
Thank you. Thank you, Mark. So now, could I request Secretary Bhushan to really make his comments? Thanks a lot, Secretary Saab, to join us all the way from India and early in the morning. And that too from your office, it seems. But over to you, Mr. Bhushan. And look forward to your remarks. And if I may hazard a thing here, please keep it to 10 minutes because you're going to be between us and dinner.
Thank you. I would try to be, to conclude my remarks in less than 10 minutes. So very good morning to Honorable Union Minister of Health and Family Welfare, Government of India, and to Hari. Very good evening to Professor Richard Dasher, Professor Michael Enright, Professor Mark Esposito, Professor Subramaniam, and my good friend Amit. Let me place on record my deep appreciation of this paper and to the authors. It's indeed thought-provoking. I have glanced through it from end to end, but I would like to read it once again. Two comments that I would like to make in respect of the paper, and then I would talk of certain other things. The first is that the authors may also consider making it a longitudinal study over a period of time. The second comment is that with the advantage of hindsight, we have realized globally as well as in India that almost all COVID vaccines that were used globally are indeed disease-modifying vaccines and not disease-preventing vaccines. So having said that, we must then make this paper or study more nuanced by looking at the kind of impact in terms of reduced days of hospitalization and maybe increased days of home isolation, which led to complete recovery and its impact on the economy. So these were two issues that I wanted to make in respect of the paper. Coming to India's response, three things stand out for me. There are certain elements that have been focused by the Honorable Minister for Health. There are certain other aspects that Hari has referred to. What stands out for me, because I now have been looking at this crisis for the last almost 2.5 years as Secretary Health and Family Welfare, is one, the evidence was science and evidence-based. So therefore, the response was more robust, was more vibrant. We were able to, for want of a better phrase, sell it to the people at large, being science-based and evidence-based. The second element that stands out is the strong political will which supported this response all through. We had three major waves, one caused by the original Wuhan virus, the second caused by the Delta variant, and the third by the Omicron variant. So this political will was strong, sustained, uniform throughout. The third and most important thing to my mind is the agility of the response. We were able to quickly change our strategy and finer points of how we were responding across a huge country with diverse cultures and geographies and equally significantly huge bureaucracy with its elements of slackness, which did creep in. And this agility eventually answered that rhetorical question of whether the elephant can dance. So at the end of the pandemic, and I assume that we are seeing the end of the pandemic, we have at least a definitive answer in India that the elephant can indeed dance. Having said that, let me try to disaggregate the three major areas that Professor Richard Dasher referred to in his presentation of containment, vaccination, and rehabilitation packages. I would disaggregate them into 8 different elements and probably give half a minute to each one of them. So the first element of this entire public health response to COVID pandemic in India was surveillance and containment. So I would see surveillance as an integral part of containment. The second was the infrastructure preparedness, because when we started, there were obvious limitations of the health infrastructure. The third is logistics preparedness. The fourth are plethora of clinical management guidelines, because there needed to be standard templates across the country to ensure quick and agile response. Fifth would be the human resource capacity building efforts. Sixth would be the risk communication to 1.4 billion people. Seventh is the vaccination, development of vaccines, deployment of vaccine, and tracking the adverse events, which in some cases happened because of vaccination, and managing them. And last would be the financial and the rehabilitation packages. Coming to the first of surveillance and containment, screening and isolation of international passengers and domestic passengers. We needed guidelines for them, uniform implementation of those guidelines, then containment zones, then again a standard template of how these containment zones would be operationalized, then strengthening the testing across the country. Minister referred to it, and we created for the first time an Indian SARS-CoV genomic consortia of 52 public and private sector labs, which were doing continuous genome sequencing to find out how the virus was mutating. The second of infrastructure preparedness went from hierarchical health facilities which were created from primary, secondary, and tertiary healthcare facilities for COVID management to field hospitals, which were set up at short notice in the foothills of the Himalayas, in the deserts, in the coastal regions, so on and so forth. The third, the logistics preparedness. When we started, there was no domestic capacity of manufacturing of N95 masks, PPE kits, and other associated devices and equipments, ventilators. And by the time we were approaching the beginning of the second wave driven by Delta variant, we had a significant indigenous capacity of all these elements. Then the logistics preparedness and clinical management guidelines. There was a scientific task force that was set up by the federal government, which devised these clinical management guidelines, disseminated them across states, engaged in dialogue with critical care medicine specialists, with people who were looking at upper respiratory tract or pulmonary medicine, and ensured that this was uniformly implemented across the country. The fifth element of human resource capacity building was done by using information technology. We created from scratch a digital training platform which goes under the name of IGOT, Integrated Government Online Training, and there various digital training modules were uploaded, and our normal or general duty medical officers, as we call them, GDMOs, these are people who have undergraduate degree in medicine, they were repurposed to handle COVID cases. Then the sixth element of risk communication is important, and that is the role which all state governments played addressing vaccine eagerness, vaccine hesitancy. Thankfully, we do not have an organized lobby of anti-vaxxers across the country. So that was the advantage to begin with. However, there were elements which were addressed through appropriate communication. Then we come to the seventh element of vaccination, where today, when we engage in this dialogue, there are 11 vaccines, COVID vaccines, that are being manufactured in our country. Large number of them are under license arrangements, but equally significant number are those where R&D has happened in India, vaccine has been developed in India and is being manufactured in India. And as we said, 2.2 billion doses, all digitally captured, all with QR codes, and all corresponding to digital vaccination certificates. Finally, the financial package and relief, roughly 270 to 280 billion US dollars, both in direct and indirect terms. However, if we look at the kind of financial packages which were given to states only to create health infrastructure and health facilities, we had emergency COVID response package of 1.8 billion US dollars. This was rolled out in 2021. Then we had a subsequent emergency COVID response package 2, which was 2.8 billion US dollars. This helped the states to create necessary infrastructure. And today, when we engage in this dialogue, we have an ongoing program of Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, which will continue till 2025-26 at a cost of 7.7 billion US dollars, again, to strengthen the health infrastructure in those areas which have been historically deficit in terms of this infrastructure. So I think now I have overshot my time. So this is a huge complex response, and we hope to continue engaging with the academic community to ensure that these processes are documented and evaluated, so that with the great advantage of hindsight, we are able to pinpoint the areas where we could have danced in a better manner. So I thank you for having given me this opportunity. Thank you.
Thank you. Thank you, Secretary Saab. But just one quick request, I would like you to make a comment on the being the recipient of the Porter Prize for the year 2023.
On behalf of the Union Ministry of Health and Family Welfare, it is indeed an honor and privilege to be the recipient of this prestigious award. And we hope that we treat it as a milestone which would encourage us to do better in future and to ensure that our responses are more agile, more evidence-based, and we are able to engage with the community at large to explain to them why certain interventions have been initiated to ensure a greater offtake of those interventions. Because at the end of the day, we must realize that whatever we do in the area of social sector, particularly health and education, has an intrinsic link with the economy and the performance of the economy, both in the short term and in the long term. I once again thank you, all of you, for having considered us for this prestigious award. Thanks a lot.
Thank you. Thank you, Secretary Bhushan. Thanks a lot for joining us. Thanks a lot, Subbu. Thank you, Hari. In fact, I would like to thank everybody on the dais here. Thank you, Christian. Thank you, Michael. Thank you, Mark. Thank you, Richard, for being such a support. But now, without further ado, I would just like to invite you all for dinner. We go to the faculty club. We can just walk down there, or you can take your cars. And we start tomorrow morning exactly at 8:15 over breakfast. And we have Mr. Amitabh Kant, who's going to be talking to us first thing up in the morning. Thank you. Thanks a lot for joining us for the day today. And I hope you enjoyed the conversations and you take